Hello, everyone. Good afternoon. Welcome to SHIP's webinar series on HIV and COVID-19. Actually, for 2021, this is already the second one. Today's webinar is all about the positive stories of our dear brothers who already got vaccinated. We will listen to their stories regarding their vaccine experience. So without further ado, I'll turn you over to our moderators for today. Let us all welcome SHIP's Medical Director, Dr. Kate Leritana, and one of our allies and staunch HIV and AIDS advocate, we have Sir Wango Galiaga.
Hello, magandang hapon, everybody.
Hey, everyone.
Good afternoon. Hi, Wangs.
Hi, Doc Kate.
Great to see you.
Hello. Yeah. How I saw on one of, I can't remember if it was your which social media site that you had about you got yourself vaccinated already.
Yes, I did. It's my second week post first dose of my COVID-19 vaccination. And what about you? Have you had your vaccine yet?
Not yet. The thing is, there are discussions already between where my LGU about getting people registered for their vaccination shots. I've also gotten, because I work as a teacher, there's been talks with CHED about getting people on a list. But because I have the privilege of having rich relatives, I'm already on a list of a private organization getting. So I'm not putting myself on the list yet, so that other people who do not have the connections or the privileges might be able to get the free ones, since I can afford myself. So I'll be probably getting myself vaccinated third quarter of the year when it's available.
So are you excited to get the vaccine?
I'm very much excited. I actually can't wait when people start talking about, vaccine rollouts, that vaccines have started to arrive. I've been very much wanting to get myself vaccinated. I've been reading articles that they've been releasing already from the United States about what happens the moment you get vaccinated. So I've been reading that, and the idea that you might be able to have regular, natural, social relationships with people who've been vaccinated as well, without fear of transmitting the virus to other people. I've been really excited for that. I live alone. I've been living alone for the most of the year. So the lack of physical connection with other people, it's something to look forward to.
Right. Well, I'm so happy to hear that you're actually excited to get the vaccine, because more often than not, I hear people who are afraid to get vaccinated. And I hope that's one of the things that we will be talking much about today. Our objective is really to provide a lot of information on a personal level from our distinguished guests about how they feel when they got the vaccine, so that we can inspire our brothers and sisters living with HIV to actually get the vaccines themselves. So without further ado, I would like to introduce our special guests for today. We have two of them. Our first guest is Michael Carter. Our first guest rose to the spotlight when he shared his experience in joining a COVID-19 clinical trial in 2020. So we don't have much of that experience here in the Philippines just yet, maybe one or two. But it would be great to hear some personal experiences from Michael. He was interviewed by HMAP and AMFAR to shed some spotlight on his story and to give due recognition to people living with HIV who actually participate in such clinical trials, which actually leads to the confidence that we have now in recommending the vaccine to people living with HIV. And joining us from London, it's morning there and it's afternoon here, and we're so happy to have him here with us, is Michael. Hi, Michael.
Hi, Michael.
Hello, I'm very happy to be with you too. It's a real joy and privilege to be able to share my experiences.
Michael, I want to ask the first question.
Yeah, sure.
How is it possible to be a part of a clinical trial? And isn't that scary to be part of a clinical trial? I mean, what does that entail?
Well, I've been a member of several clinical trials. I've had HIV since 1991, and I participated in some of the studies that led to the development of modern antiretroviral therapy. And some of them were drugs which are no longer used, and also or treatment strategies which were fallen by the wayside. So I'd had that experience going back decades,
Mhm.
and I saw a call for people with HIV to register for a sub-study of one of the vaccine studies. And they wanted 500 people with HIV, and it was to receive the vaccine that's based on research conducted at Oxford University, and the vaccine developed by AstraZeneca. So I inquired about participation. Immediately I saw it, and went through an intensive series of pre-registration questions to make sure that I was eligible for it. It had very, very strict recruitment criteria. And then I was subsequently enrolled on the trial and received, I'm looking forward to talking to this in a lot more detail, I received both doses of the vaccine at the end of 2020.
What were
Wow.
the kinds of questions and requirements that you needed to be able to take this medication?
As you'll know, with clinical trials, they often have very, very strict safety recruitment criteria, and they want, first do no harm, the baseline of no harm at all, and so you can see the benefit of the vaccine. So I had to, one of the criteria were that you had to have diagnosed HIV for this study, that you had to be taking HIV treatment, you had to have an undetectable viral load, and you had to have a CD4 cell count over 350. So these were all the baseline ones. So, it's standard sort of recruitment, to an extent recruitment. Then you had to not to have had COVID already. So I was tested for COVID and then there had been reports of, and also no history of severe allergy to medications. Now, I was very honest and upfront here because I have a slight allergy to penicillin, and I was also have a very, very weird allergy, which could cause something called exercise-induced anaphylaxis, that if I eat wheat before running really, really intensely for a long period of time, I can go into anaphylactic shock. But I was very upfront. I told them everything. I think, I didn't think that the trial was going to involve wheat eating and intensive exercise. Just in case there's some mechanism. So then I was, and then I had a very, very thorough medical assessment and much more thorough than my routine HIV clinical visits are now. Physical examination, extensive blood work, a whole arm full of blood given for blood tests to test baseline levels of everything. And it was only when those results came back and they were satisfied that it was safe for me to proceed that I was actually enrolled in the study and received my first dose of the vaccine, as it was the AstraZeneca vaccine. And I was warned, this is important to say, I was warned about every possible side effect that they had seen, including there'd been some very rare ones which had led to the pausing of the trial for a very short period of time last summer, and which was then shown not to be associated with the vaccine, but they were very transparent about the possible risks of participation,
right?
Also about the possible benefits as well. And then also it's so funny that I get an annual flu vaccination, and I was warned that this vaccine, it could be very painful to receive, a pain in the arm, and then possible side effects afterwards. And so he said, you must take some paracetamol the morning before you come, and we recommend that you take that day off work, and And then I went for the vaccine, and I actually thought they were still swabbing my arm when the actual needle went into my arm. It was at worst a small scratch. I know that experiences can differ. It was at worst a small scratch. And I'm sure we'll talk about side effects in more detail later. That I didn't have any side effects. I didn't sleep very well the night before because I was excited about getting it. This idea of getting early access to this product and thinking about the protection it might provide. And also I had been a little bit anxious after they talked about side effects and thinking, oh gosh, am I going to have 3 days of feeling like I've got flu? And, and then I felt a little bit tired the day after the vaccine, but that was it. And it was But that was more than compensated for the feeling that, gosh, I'm doing something just to protect myself, but also to make the world, help the world return to normal. And there's also another, you know, as a point, an ethical point of view as well, is the AstraZeneca vaccine has been developed. The company developing it made a commitment to provide it at cost. They're not making any profit from this. You know, they'd hoped to get a boost in their share price, I know, from doing this, and it's encountered all sorts of problems I'm sure we'll talk about, and a lot of those I think have been politically motivated as much as anything to do with the safety and efficacy of the vaccine. But there was also the sense that, you know, this is a good thing to do. I'm in a position to be able to do something. I also thought that there was no risk to me whatsoever in doing this. I was recruited to the trial in late October, early November. The product was within a month or so of having having the main study information published. This was a kind of small sub-study. I knew I was getting the vaccine. It wasn't a randomized trial. It wasn't that half of us got the vaccine and half of us got something else.
Yes.
We all got the vaccine. And I knew, just knowing a little bit about clinical trials, that they wouldn't be conducting this kind of study if they weren't 100% sure, or as sure as they can be, that it was safe.
Right.
And also that it was effective as well, because the study was purposefully designed to see how the vaccine worked in people with HIV. Did we have a different immune response? You know, was it, you know, affected by any residual immune damage, or, you know, in the way it interacted with the immune system? So I knew it was there to answer a specific question, and that any benefits were going to massively, massively outweigh any potential risks. And I, you know, just seeing the way they were developing, the late stage of the study, you know, as I said, it's a kind of study I would have thought would have been conducted normally after a drug has got a license. You know, oh, let's answer these other interesting questions.
Mm-hmm.
But it just seemed like, wow, what a remarkable opportunity. Sorry.
No,
please.
so I mean, I'm super excited. I want to find out what were their findings about how it reacted to people with HIV who are taking medication.
They haven't been published yet, I think. You know,
okay.
I had intensive follow-up. You know, I was at the clinic, you know, the day after the vaccine, 3 days after, 7 days after, 14 days after, and I had to fill in an online diary every single day to report on symptoms. You know, was I experiencing any symptoms? And every week I have to do a COVID test. You know, I'm sure some of you have the experience of the swab up the nose, your brain. You know,
the PCR test.
Yeah. And so I don't know what the findings are yet. You know, they haven't been published, and it would be intriguing to know.
But your personal diary, when you've been writing down all of this, were there any symptoms? Did you get?
I had no side effects for either the first or the second dose.
And how far apart were they? The first.
It was as the study was first designed, which was to have them 4 weeks apart. So I had the dose on, I think it was the 10th of November. First dose the 10th of November. The second dose exactly a month later. It was on the 10th of December or thereabouts. And now the dosing schedule for the AstraZeneca one, it seems to be that it provides a higher level of protection if the interval between the first and second doses is extended by up to 12 weeks. It's very, very interesting. So that's really interesting. But in the meantime, between me receiving the first dose and receiving the second dose, the study results were published. The main study results were published, and they showed that the vaccine provided 100% protection against serious disease and death. And what a remarkable, just utterly remarkable. And that it provided 62% protection against mild disease. And now the problem was that the Pfizer results and the Moderna results had come out, and they were showing 90-odd% efficacy. So this then started to look like an inferior product. But if I had been told at the outset that, you know, we're about to publish data which shows that it means you won't die of COVID or you won't need to go into hospital if you get COVID, and that it's, you know, it's well over 50%, about 2/3 effective against you getting basically what would feel like a case of flu, I would have been offering my arm to them, saying, "Give it to me now." You know, it was remarkable. It is remarkable that within the space of a year, in the space, you know, that something has gone from laboratory stage to being, and also with conducted along the lines of, you know, this is, nothing has been skipped in this trial. It has been as rigorous as any other. In actual fact, there has probably been more of a spotlight on how safe and effective these vaccines are than most other products. And I know a lot of people who are listening, and, you know, a lot of you will recognize that, you know, with a lot of anti-HIV drugs, we've only come to know of some of the side effects well after the study. People have been taking them for years and years and years. But the bottom line for this is that, you know, this vaccine, I know, means I will, you know, I will not die of COVID. First of all, that's the thing. I am highly unlikely to get ill because of it, because of COVID. And also, there's now very, very compelling information that should I get COVID, I won't, my risk of passing it on to somebody else is massively reduced as well. It's the same thing with, you know, anti-HIV drugs.
Right, I was going to say that as well. Yeah, it's like just like it being undetectable. It
is exactly this, because, you know, if you get it, the level of virus, if after being vaccinated, the level of virus you have is so low, it's getting to the world where you're not really infectious, and it's just remarkable. And it's also, it was, whilst I was enrolled in the clinical trial, just how important it was to get these vaccines out was really brought home to me as well. You know, I'd always recognized the seriousness of COVID, and, you know, much as I have hated the restrictions with every fiber of my being, I recognize they were essential, in that the vaccine was the way of the best option we had of getting back, as you said, the life you want to lead, of seeing people, of hugging people, of doing the things we take for granted on a daily basis, but also just how devastating this infection is. And you see statistics, and gosh, that's frightening, and things like that. And then, well, my dad got COVID he was 87 years old, and he got COVID in November, early November, after being admitted to hospital for something else, for another chest complaint, and he died. And, you know, and it was a horrible death, apparently. I couldn't go and see him because of COVID restrictions, but another brother did, and it was not nice. And, you know, okay, it doesn't matter, he was 87 years old, he had several years of good health left, and it was just horrible. And that getting vaccinated doesn't just protect yourself. There is this really important, you're doing something for humanity. You are protecting, you're protecting your loved ones, but you're protecting the person 10 degrees of separation away from you, who may have that vulnerability. And I see it as being a moral, for me, it's a moral responsibility to take a vaccine, and it's a sign of the acknowledging my responsibilities to my fellow citizens, other men and women, and to spare people pain and suffering. And the more of us who get it, the more lives are going to be saved, the less grief there is going to be, and the quicker, and just to be perfectly selfish as well, the quicker we can get back to living lives which we want to lead.
Michael, I have a question. You have to get the second shot before you can start living this way, or what happens between the first and the second shot?
Yeah, it's really interesting that, I mean, this is, isn't it? The information about, it does remind me of HIV, is that how quickly information, how much we're learning and how quickly we're learning it. And that I had thought that I've had my first jab, and that means I've already got a significant degree of immunity. It takes about 3 weeks, I think, for you to have a significant immune response after the first jab. Well, that's what the information in the public sphere is at the moment. But then the first jab already provides you with a significant level of protection. You know, it's the second jab is essential and important for boosting that to the high levels which have been seen in the clinical trials, and also to give you a sustained immune response to it as well. You know, it's looking like we are going to need annual COVID jabs at the moment, partly to protect against emergent new variants and things like that. And well, I just think, you know, I get a flu jab every year, and I think a small prick in the arm is a small price to pay for sparing people from grief and hardship and death, and having something approaching the kind of lives we want to lead.
So it's suggested that after your first jab, even though you have some immunity, that you should still stay at home.
Well, social distancing is the term which is used here. I don't know if it's the same, that, you know, to maintain, to behave in a way as if, you know, you hadn't had the jab, as if, you know, the restrictions are still there in place. And it's interesting, in the UK, we've now well over 50% of the adult population is vaccinated, and over 50% of the entire population now has COVID antibodies. But restrictions, we had a very severe lockdown was put in place here in December. Started in December, accelerated in January. And restrictions here are only just easing up. Monday was the first day you could meet up with people in private gardens, or a group of 6 people outdoors. So they're taking a very having been quite cavalier earlier in the pandemic, they've now taken an ultra cautious approach. And a lot of messaging has been that, listen, we're hopeful, but we need to get to massive numbers of people being vaccinated, you know, almost all the adult population, to be honest, before we can significantly ease up. Whether or not that turns out to be necessary will be interesting to see. But I think that the country, you know, places like the UK, which have been lucky, and it's thanks to the National Health Service here, which has been utterly remarkable, and a cautious approach to it, vaccinate as many people as possible. In the UK, we had a policy of the first 9 priority groups, and that was based upon age and pre-existing clinical conditions. The groups who were most likely to be hospitalized and most likely to die of COVID. I think in excess of 90% of both of those negative outcomes. And the UK is on track, and that's everybody aged over 50 and everybody with a significant pre-existing clinical condition, which HIV falls into, regardless. It's ultra cautious, regardless of having an undetectable viral load or, you know, a good CD4 count. And everybody in those groups will be vaccinated will have had at least 1 dose by the 15th of April. So that's just 2 weeks away. Great. And then the objective is to vaccinate the rest of the adult population here by what's early of our summer. That's by July, but it won't be then until well into late summer, well into the third quarter, that we're getting that everybody's had their second dose. And then they'll be starting to give the booster shots again. You know, from November onwards, everybody's going to be called, or September onwards, everybody's going to be called in again to get a new vaccine if there is a new variant out there. So it's all been rolled out. It's been very cautious. And, you know, there's been a massive drop in COVID cases in the UK. And part of that's because of lockdown measures, but detailed examination of people's antibody levels and risk of transmission in closed settings, for instance, care homes, where we had terrible mortality in care homes in Britain at the beginning of the pandemic. It's showing that the vaccine really, really does work, that the number of hospitalizations and deaths amongst the demographics that have received the vaccine over 3 weeks ago, where they've got the good immunity, has just plummeted. And the information's coming from close physical settings, for instance, care homes, to show that the vaccine also reduces the risk of transmission really
Wonderful.
significantly as
Wonderful.
well. So it's doing everything. I mean, it's basically, it's meeting expectations, I think, and more some. That when they were talking about vaccines, it's really important to remember this. They were talking that they would license them if they were 50% effective. And every single product that we have got way exceeds that level of effectiveness. And, you know, I'm sure that people will have seen a lot of the negative news reports about how some countries reacted to some very rare occurrences of blood clots among some people shortly after they'd had the AstraZeneca vaccine, which is the workhorse of the vaccine rollout here in Europe, and will actually be, I think, across a lot of the world, because it just, the way it's stored and its cost. Well, it was shown in a detailed examination of this that, you know, I mean, so many people have an experience that they, oh gosh, something bad's happened to me. It must be because of something I've just had. Well, it was shown, detailed independent review, that incidence of these blood clots is actually lower in people who've had, you know, the COVID vaccine than in the general population. So it's just coincidence, and it's just been noticed. You know, everything is being done that can be done to reassure people about the safety and effectiveness of these vaccines.
That's such great news. Doc Kate, I think you might also have some questions.
You know, Michael, it's so nice to hear about the good things happening over there, and the fact that in a few days or in a few weeks, almost everybody will have had their second dose is amazing. And imagine the benefit of that. Direct benefit is that you're seeing less and less cases, and oh wow, we would love for that to happen here. So my question is this: so you're saying that the people living with HIV are on a priority level over there. Do they get their vaccines along with everybody else in the designated like NHS sites, or do they get them in their HIV clinics?
Yeah, there's two ways of doing it. That if you've told your GP that you have HIV, you'll be called up through the NHS vaccine rollout scheme. So it'll be the general vaccination centres you'll go to. And they won't know at the vaccination centre anything about your clinical status. You know, they don't know, you know, you could be a healthcare worker who were prioritised, you could have diabetes, you know, they just don't ask any questions. It's just to give you the vaccine. And it's just, they are brilliantly run and operated, these vaccine centres as well.
Can I just ask a question first? When you say, when you ask your GP, that's your general practitioner.
Yeah, sorry.
It's not a Filipino term, I think. So just
right.
when you ask your doctor.
Your family doctor. Yeah.
Okay.
Yeah. If you haven't told your family doctor, or you don't want your family doctor to do this, your HIV clinic will organise it for you. You can get it at the HIV clinic. So that was originally a small loophole, and it was corrected here as soon as they realised it was potentially going to be an issue for some people. So yeah.
Okay, so that's great. They have two options, because I like the fact that they don't need to actually disclose to the NHS center at all, and they'll just allow them to get vaccinated. Do they just present a note from their GP then?
Oh, you don't even have to do that. That you have to register online or by a telephone. You get an invitation either online, by text message, or you know, another media, and then you go to an online NHS portal and you register to go to a vaccine centre, and it's normally within days, and normally nothing more than certainly for people living in a big city, nowhere that's more than a short walk away. And then you just turn up and you're seen very quickly. You have an appointment slot, You get the vaccine, and for some of them, very early on in the rollout, people were asked to remain for 15 minutes in a waiting area to check if they'd had a bad reaction. But they stopped doing that because so few people were, so they don't need to do it anymore. It's been remarkable. And then at the HIV clinic, it's like a routine HIV clinic appointment. You just go, you get the vaccine, and you get the vaccine they have at the vaccine centre. You don't choose which one you get. So let's say you go to St Thomas's Hospital in central London and they're using the AstraZeneca vaccine, that's what you get. A hospital a mile away might have been given the Pfizer doses for that day. There isn't a question of patient choice here as concerns the vaccine. You get what's available.
All right. Okay, that's great. I want to see that happen here too. I want it to be super accessible to everybody. Our procedures are like, I don't know, it's so hard, it's difficult. But one question I want to ask of you, Michael, your mindset is so admirable because you're thinking of not only yourself and the benefit that the vaccine will have on you, but the benefit it will have on the people around you and your role in society. Now, you also mentioned that you have been part of clinical trials before for antiretroviral therapy. So how exactly did you get to this kind of mindset that you want to submit yourself to volunteer to do these things?
I mean, there is a part, it's humanity, isn't it? There's always there's an altruistic aspect to it that, do your bit. But there's also a selfish aspect to it as well, which is, it was, the trial, it's always presented to you that, hey, you might get early access to a drug kind of thing. It might do you some good. And with the vaccine, it was like, wow, I knew they were progressing well. And gosh, this is a chance to get it. But then there is this thing as well. It's about giving. It's about sharing. It's about doing your bit for your brothers and sisters, for people around you. And we only recover from these things and we only cope with these things. And I think if, the HIV pandemic showed us, as much as this pandemic is that we achieve so much more when we act together, when we look out for one another, when we don't try and divide ourselves into little groups and don't get too selfish. And, for me, it's part of the operation of a civilized society is doing things for other people. And, and of course, I'm not trying to present myself as a saint or anything like that, but there was a personal benefit from it as well. It was a win-win situation from it. And, the antiretroviral trials I took place in, they didn't really come to anything, but they were important in helping us to get to the stage where we had those first triple combinations in 1996. So I can remember when they became available, and I wasn't involved in those. I was involved in something which would have doctors throwing their arms up in horror now, and a monotherapy with an unboosted protease inhibitor. It couldn't have been more likely to cause resistance. But even then, there was really, really strict safety and monitoring that as soon as it's shown it wasn't working, stopped the treatment. And in clinical trials, they do have these guarantees in place to try and ensure that they they don't do any harm. And that was certainly the case with the COVID studies as well.
Thank you so much, Michael, for sharing all of this information. We'll move on first to our other guest before we do a Q&A session with everybody. Dr. Kate, can you introduce our second guest?
Thank you, Wango. Thank you, Michael, for sharing those wonderful tidbits about your experience. It was very nice to hear from someone who has been part of history and has actually contributed to the benefits we are reaping in the present. Thank you for your sacrifice.
Thank you so much for that.
If you want to call it that, thank you for your heroism. Now, moving on, we have another special guest here today. We are joined by Sir Dave and Valenzuela from Bataan, Haven, and Hearth. Dave is a DOH case manager who works in the HIV clinics as a frontliner. So he is facing clients and patients every day in providing HIV service delivery. Being a PLHIV himself, he has two things now to prompt him to actually get the vaccine ahead in the priority list as a frontline worker and as a PLHIV. So now let's call on Sir Dave to share his experiences. Hi, Dave.
Hello.
Hello, Dokora. Hello, everyone. Hello. Kamusta po kayo? So, it's my privilege po no, to be part of this session. So, ayun po.
Dave, can you tell me about yung day-to-day mo naman na experiences as a frontline worker? Like, what things do you do on a daily basis that make you at risk for contracting COVID?
Basically, the daily routine that I had is first is helping our clinic manager on assisting our clients, technically by their ARV refill, and for some walk-in clients, we facilitate their HIV
That's great.
counseling and screening as well if we need to. No? And most of the time, we are interacting with different people that we don't know if they have the virus by themselves or they don't. So the time that I had been asked to get vaccinated, no, to be honest, at first I have this hesitation because there is no at that time there is no a clear picture between COVID vaccine and HIV. You know, just like others, I have those kind of thoughts as well. But then this the ship you guys conducted the webinar activity regarding COVID vaccine and HIV. So that's the time that I had this realization that, oh, it's safe for me. No, there's nothing wrong there's nothing wrong taking it. So when they asked me again if I want to get vaccinated, and I said yes, whatever the vaccine is there, I'm gonna take it.
So, Dave, can you tell me what were your initial fears? So, when they offered it to you the first time, you said that you were hesitant. What thoughts went through your mind? That's why you wanted to take a step back for muna.
Maybe because siguro yung mga pumasok sa isip ko is what if mag-react yung vaccine not only with the COVID kung meron man ako that time, no, and with the HIV itself, no. So that's what goes in my mind, no, what will be the result if I take this without knowing, no, without having any proof na magiging okay lahat. So yun lang siguro yung gumulo talaga on my mind that time.
Okay, so you said that aside from, so you watched the webinars about us encouraging PLHIVs to get vaccinated because there are evidences that support it. Did you ask help from the doctors in your clinic to give you more moral support so that you were able to say yes na?
Actually, it was fascinating, no, kasi that time, no, that time after you guys conducted the webinar, no, I immediately contacted Dr. Noel Laksamana of Bataan Haven, and I asked him about the COVID vaccine. And you know, one thing's funny kasi sinend niya sa akin yung art card na ginawa mismo ni Ship regarding dun sa COVID vaccine, no, that you need to have this kind of CD4 and this data, and sabi ko, okay, we're watching the same webinar. So that's it. So we both laughed and decided to take the vaccination as early as possible na mabibigay sa amin at schedule.
Oh, I'm so happy now we had some influence in you getting the vaccine. So can you tell me what your experience naman was when you actually got your first dose of the vaccine?
Okay. Before getting the vaccine, I was informed na magkakaroon nga ito ng mga side effects such as headaches and body pains, some experience fever and other stuff. No, so they even told me na, oh, you take this medication, paracetamol, before you take the vaccine to lessen the side effects. But you know what? I did not take anything prior to vaccination because I want myself experience the same thing na na-experience nila sorry, I want to experience it so that I can rely it to others. No, na the effect of this vaccine for me would be the same to the other people who has not, who don't have HIV. No, so yung naramdaman nila is same lang sa naramdaman ko, which is sa akin, doktora, to be honest, hindi ganun yung naramdaman ko, which is yung iba sobrang sakit ng ulo nila, ng katawan nila. Sa akin, less lang. Kumbaga, tolerable. I didn't even take any of medication, just plenty of water. Yun lang, tubig lang ng tubig.
Wow! So you mean to tell me you did not have any of the dreaded side effects that you were worried about in the beginning?
Yes, doktora, exactly. So, iyon yung pinagpapasalamat ko na even ginagawa ko pa nga siyang joke eh. Actually, sabi ko, is it because I'm taking ARV kaya ganun lang yung naramdaman ko na na side effects, or it's just that yung katawan ko mismo yung nagre-response dun sa vaccine to feel na less yung naramdaman ko ng mga side effects. So, ayun.
Well, I'm very glad that you didn't have the worst of it, no? And your intention to actually feel the natural effect of the medication is very heroic, in the sense that you wanted to, parang you did not want, if you were giving birth, you did not want anesthesia, so you could recount the experience to everybody else who's going to go through the same thing. That's very heroic. Not everybody would do that, but it's good that you didn't feel anything. So now that you had your first dose and you're waiting for your second dose, what safety practices are you doing? Because I believe now you're still working, you're back to work, so balik PPE, facing patients. Are you somehow lax now in your safety practices, or are you doing the same?
Actually, doctor, I need to be honest regarding that matter. No, when I got vaccinated, typically my mentality really boosts. Na yes, I have this first protection, first line of defense, that I have got my first dose. No, but having said that, I continuously do the routine of having wearing PPEs regularly whenever I talk to clients or to someone who I don't know, and then to the other people. And I need to be honest, Doctora. No, a week before this seminar, I was talking to Sir Randy. No, I was hesitating to pursue on being one of these participants because I was exposed in a COVID positive. No? So from March 24 up to the present, naka-quarantine ako. And then nalaman ko lang yung result ng swab test ko recently, like the other days lang. And I was tested negative. No? So it's not a joke na nakasalamuha ko lang siya a few moments. No, hindi ganon. Nakasalamuha ko yung tao repeatedly. So, paulit-ulit ko siya nakasalamuha. No? Kaya nung nalaman ko na nag-positive siya with COVID-19, the thing that goes into my mind is sana lumaban yung first dose ng vaccine na nasa katawan ko. And you know what? Nung nalaman ko na negative yung result, it put me at ease na buti na lang tinanggap ko yung first dose ng vaccination, and it helped me a lot.
When are you getting your next dose?
I'm waiting for the advice because the first dose was given to me last March 12 pa po eh. So that was AstraZeneca.
That was just about 3 weeks ago.
Yeah. Mga ganun.
And it's already effective in the sense na you were interacting with someone constantly who was positive, but you did still not get.
Yes, actually, I was amazed. I was
amazing.
amazed by that. Even I was amazed by that. Kasi I already claim it na magpo-positive ako with the COVID-19. Having said that, na nakasabay ko itong kumain, na nakasalamuha ko siya paulit-ulit, no? So the exposure that I have with this person is, we can consider it a total risk, no? So yung exposure ko sa kanya is 100 or 1,000%. So what gives me a negative result is so relief and amazing.
Let's call it a combination of luck and whatever your immune system has, the vaccine. Because honestly, that time period, that is, pwede ka talagang masalisihan. Like you can really, there's a lot of people who have had the vaccine, but unfortunately had been incubating the virus a few days prior and was asymptomatic, and the infection just manifested like the day after. So some people might attribute it to, oh my God, I had the vaccine. The vaccine gave me COVID. So it's very tricky. And Dave, you were in that exact same scenario where you could have
Yes.
easily gotten COVID, you know. And for whatever reason, we're very happy that you didn't. No? We don't know if it's really the vaccine or a combination of everything else. But I think it just goes to show that you should still put your guards up.
Yes,
Even if you
exactly.
have had the vaccine, that you should still practice all the minimum safety precautions at least.
So if I'm to understand this correctly, based on our two guests talking and from what you just said, Dr. Kate, does that mean that we have to isolate ourselves for a few days, of the 8 days or 10 days it's required, have ourselves tested before we get ourselves vaccinated? Is that the
No,
situation? Did I
you
get that
don't.
correct?
No, you don't need to do a COVID test prior to vaccination. I'm just saying
Okay.
that the risk is always there. You know, you could
I
have been
see.
exposed before, and it just takes a little bit of letting your guard down. And here in the Philippines, Michael, we found out that eating together is really a risk factor for us. So we Filipinos love gathering, eating together as a family and
Yeah.
as workmates, and it has been pinpointed as one of the risks of transmission. So we need to start eating separately, guys. And we're feeling the surge right now. We're up to 9, 10,000 cases a day. We need a break, guys. So let's just please take care. So thank you, Dave. Wangs, do you have any questions for Dave?
Actually, I just wanted to know if does this mean, for example, as a healthcare worker, as more healthcare workers are going to be vaccinated, does that mean there will be less need for PPEs and all of that happening within the hospitals? Or like, I mean, minimum is like mask and face shield and social distancing, but does that mean that you will not be having to use those, from what I hear, are very uncomfortable PPEs, or is that still a requirement even if you're vaccinated?
Yeah, we will still encourage people to practice the same level of protection that we've been doing before, especially now that we are faced with various variants.
Variants. Okay.
Yep. And these variants weren't around yet when the vaccines were being developed. That's why Michael mentioned earlier that they're going to get a booster, which means it's a third shot for them, because they want to see if getting that actually will help address the infections from the many variants around us. So it doesn't mean once that you're going to let your guard down once
Right.
you get vaccinated. We still at least if once we achieve a majority of the people vaccinated possess a type of herd immunity, then we will have some sort of peace of mind. But now that our vaccine rollout is not that strong yet, let's try to prevent infection. Why don't we take some questions from the people watching? Rad, can you please let us know what questions we have?
Okay. Some of the questions actually have already been asked. Okay, like for example, a while ago, one of the questions that was shared with us was that since Michael and Dave have already been vaccinated, do they still practice the minimum health standards such as wearing masks, practicing social distancing, and doing a frequent hand washing? And they were able to share it already.
Can we ask? Sorry, can we ask Michael? I want to know what the practice is in the UK.
You're still unmuted. Thank you.
Mask wearing is compulsory in all public spaces. And we've still got very strict lockdown rules here that all retail shops stopped. Everything you want to do is currently forbidden, apart from meeting people outside. So hand washing recommendations, yeah, it's a very, very cautious approach. You're still encouraged to act as if you you could still have the virus and transmit the virus. And I think that's probably the very wise approach to have at this stage, where we've still got 50% of the adult population, close to 50% of the adult population is still unvaccinated. So it's taken a very, very cautious approach. But I think that that cautious approach will get us to the place where things can ease up so much more. We'll bring it closer. And also, once I got used to wearing a mask in public spaces, I don't find that in the least bit intrusive. And, you know, I'll happily to carry on doing that if that's something that's needed, and the hand washing and other things. And fresh air, that's another thing, a big thing as well. Well ventilated spaces.
Yeah, that's great. So are you guys allowed to congregate, let's say in groups of 4 or 5 small groups outside in parks and to have picnics? Is that okay?
As of Monday, you can meet in a group of 6 outside, but it can be from no more than 2 households. So it's still very strict.
Oh, okay. So just a cohort of neighbors and that's it.
Well, yeah, like yesterday I saw a friend, and you couldn't meet in people's gardens or things like that. It had to be in a public space before. So I met a friend in her garden, and there were just 3 of us. There was myself and my partner and her, and that met one of the rules. There were 2 different households there, so it's very, very strict here. I know in other places, more in other countries which have had strict lockdowns as well, they've had a different interpretation of how many groups can meet and things like that. But the management of the pandemic went badly wrong in Britain. The government took too lax an attitude. And it meant that this lockdown that we had to be especially severe. And I think there's been a determination to get it right. 3rd time lucky kind of thing, or unlucky for so many people. Try and get it right now. So the rules have been very, very strict about you still can't meet indoors with other households, with other people you don't live with. You know, that won't change for another 6 weeks, and that's with things going very well. So we're still being encouraged to believe that, hey, even though you've had the vaccine, you've still got to behave ultra cautiously. And it may, my personal instinct, and it's nothing more than an instinct, but reading the information that's coming through, that is been a very overcautious approach, but it's understandable that that's where we are now. And it's almost like another 6 weeks of hardship for things being sustainable when easing up can come, you know. And it's getting to the point where, you know, everybody's sick of these lockdowns, of these restrictions, and, you know, we want them to be over as quickly as possible, but get it right this time. And if it means an extra week or 2 of restrictions for things being better in the long term, well, shrug one's shoulders and get over with it. Yeah.
Yeah, it's been tough on us to we're on our 2nd major lockdown, like a year after we declared a lockdown. This is our 1st anniversary gift to ourselves. We will repeat what we did a year before. So, Michael, I know you have to jump off to another meeting, but please, can we have one last encouraging message from you to our fellow PLHIVs here who are still hesitant to get the vaccine?
I'd say that there's nothing to be frightened of with the vaccine. That the benefits of it are enormous, absolutely enormous. Just think of it. It's like HIV treatment. You are not going to die of COVID. You're not going to get seriously ill of COVID, and it will massively reduce the chances of it, should you get it and get a mild illness, of passing it on to somebody else. And the risks attendant on it are minuscule. The worst people experience is kind of feeling like they've got a bad cold or the flu for a day or 2, and most people don't even get that. It's the only realistic way of getting our lives back to normal. You'll do yourself an immense favor by getting it, and you'll also be doing something for humanity, for the people you care about, and just get life back to what we want it to be. And also, let's hope that we learn that everybody learns some messages about this, our political leaders, society generally, about how we manage our health services and how our attitudes and our responsibilities towards our fellow human beings. So please get it, you'll be doing everybody a favor, including yourself. Thank you. It's been a real pleasure to speak to you.
Thank you so much, Dave, and Michael, and all of the wonderful things that you just said. That your final speech is just, I think, is very important, not just for the UK, I'm guessing, but very much here in the Philippines, where there is some fear or trepidation about taking the vaccines, and about the way the whole pandemic has been managed. So thank you very much for your time. I know that you have a busy meeting. So I know you have another meeting coming up. So thank you very much. And I hope that you have a wonderful morning.
Yeah, and a good evening to you, and good luck with that. It's been a pleasure to do this.
Thank you, Michael. Bye.
Bye.
But we are keeping Dave for more, if you want to ask for more questions.
Rad, balik tayo sa ating question and answer portion. Meron pa ba tayo natitira?
Isang madalas na lang tinatanong, siguro for Dave, ni-require ba na kailangan meron ka pang CD4 count bago ka binakunahan?
Yun sa akin hindi naman. Pero ang nangyari po kasi sa akin that time is I got the CD4 test a week prior to the vaccine. No, so nagkataon siguro na CD4 ako before the vaccine. So ayun po.
But it's not a requirement.
Yes po, hindi naman po.
Okay.
Correct, hindi siya requirement. So ang CD4 vaccine, CD4 count, para lang siyang security blanket, kasi kapag mataas ang CD4 mo, lampas 200, yung pinapublish na efficacy rate, yung sinasabi kaninang 100% efficacy, ganyan, magba-match yun sa'yo. Kasi pagbababa ang immune system mo, which is nakadepende doon yung effectiveness ng vaccine, baka hindi 100% yung sa'yo, mas mahina. Hindi ibig sabihin na hindi ka na dapat magkaroon. In fact, kung mababa ang immune system mo, mas lalo kang dapat protektahan, di ba?
Right.
Oo, hindi nga lang yun kasing effective, pero it's better than succumbing to COVID.
Right.
So, hindi kailangan, hindi requirement, but nice to know.
Yes.
May questions pa tayo, Rad?
May isa pa. Pwede mo bang ibanggit sa amin, Dave, ano yung prosesong pinagdaanan mo? Yung step-by-step process lang nung ikaw ay binakunahan. Ano yung unang ginawa hanggang sa mabakunahan ka?
So, yun po sa amin kasi naging mabilis lang po. No? First is magkakaroon ka ng assessment. No, meron kang forms na pipilautan or pipilapan. May mga questionnaire regarding on your past history regarding with COVID-19, kung may na-expose ka or other indicators such as allergies sa mga gamot. Tapos after that, dadaan ka na dun sa vital signs na iano nila. Titingnan nila yung temperature mo and everything kung fit ka to receive the vaccine that day or madi-defer ka. Tapos after that, punta ka na dun sa isa ulit sa mga doktor naman na titingin sa'yo na magbibigay ng go signal kung for vaccination or defer ka. Then the last part will be the vaccination itself. So mabilis lang po siya. Wala pa po siyang 15 minutes pero once you get vaccinated, tama yung sinabi kanina ni Michael na mag-iintay ka ng at least 15 minutes. Twice, i-check yung temperature mo, kung yung BP mo, kung magbabago, and yung temperature mo. Tapos for monitor ka for 15 minutes. After that, kung okay, all clear, you're good to go. Ganun po siya.
Can I ask why, I think Michael mentioned this and you mentioned it as well, Dave. Why do you have to take paracetamol the day before or on the day itself? And and you didn't take it because gusto mong i-feel yung buong effects, diba? But why do you have to take paracetamol?
Kasi for doon sa mga nauna sa amin na na-vaccinate na tao, no, naramdaman nila yung need to take paracetamol after
Okay.
after nung vaccine para daw malesen yung side effect. So sinadjust nila sa amin na if possible, kung gusto nyo, uminom na kayo ng paracetamol prior to your vaccination para umi-epekto na daw yung paracetamol. But I decided not to take it kasi parang ano siya parang for me para kasing naging challenge siya sa akin kung ano yung mararamdaman ko. Also, that time, ang mindset ko kasi is I will take this vaccine not only for myself, no? Just like you guys, you want to mediate with the community na it's okay to take this vaccine. So I want to be a part of that too, na I can testify myself na this COVID vaccine is safe for us PLHIVs, no? Kung ano yung naramdaman ng mga non-PLHIVs, posibleng ganun lang din yung mararamdaman natin. So I want also to encourage everyone na to get vaccinated.
And for example, if yung mga hindi naman some people might not be brave enough to do what you did. If they wanted to take the paracetamol, how many hours before the vaccination should they take the paracetamol?
Pwede ba ako sumagot dyan?
Sure.
Yes, Dr. Actually, ito ituturo ko.
Go.
Akong sasagot dyan. Guys, pag wala kayong sintomas bago magbakuna, please don't take anything. We
Okay.
don't want to risk a blunted immune response. Remember, ang bakuna, umaasa yan sa response ng immune system mo para gumana. Okay? Ngayon, kung meron tayong side effect after, like magkalagnat tayo, yan, magpaparacetamol tayo for that. Pero let's not preempt anything that could possibly affect the response.
Baka yan yung nakuha ng mga, baka naging takeaway yan ng mga nanonood at saka nakikinig ngayon na
Actually,
what you call this, kailangan mag-paracetamol before. So it's best not to take anything until you have
Yes.
symptoms. Okay. Thank you for clarifying that.
Yeah, so yung mga tao na nagme-maintenance, yes, inumin niyo yung maintenance niyo. Huwag niyo siyang itigil during the bakuna. But yung mga preemptive, baka ganito yung mangyari sa akin, wag muna. Okay?
That's
We'll
very
do it
important kasi alam mo naman marami medyo praning at saka will always try to protect themselves ahead of time, and what happens is what you said, it blunts the immune
It
system.
might blunt the immune response.
Immune response.
So, itong mga side effect na to, sometimes it's really a sign that the vaccine is working. So, in a sense, kung may maramdaman ka, may something.
That means it's working.
Meron sinaksak sa akin.
Pero I mean, I guess for the PLHIV community, sanay na rin tayo sa mga side effects, no? Kaya
Exactly.
natin yan.
exactly. Sabi ko nga, sabi ko nga, kung kinaya ko yung LTE, mas kaya ko tong effect, yung side effect nung COVID vaccine.
And these things, did they tell you, for example, Dave, kung how many times do you kung kailan mo kailangan magpa-vaccinate ulit? How long ang effectivity nung how long yung effectivity ng vaccine?
Sorry, come again. Medyo nag-lost ako doon.
Okay. How long yung effectivity ng vaccine? So you had it taken now, and then you're waiting for your second shot. When do you have to take your to get revaccinated?
Actually, ang na-mention sa akin is parang second week ng May. Doon ibababa sa akin yung second vaccine. Pero I'm not quite sure about the details. No, that's why I'm waiting with the advice kung kailan namin makukuha yung second dose.
Pero
So
pero
ano yan?
tanong ko for the second shot. After you get your second shot, that lasts you for how long? Yung effectivity rate nun?
Wangs, ang mga study yung magsasabi yan.
So hindi pa
Actually,
lumalabas.
Yeah, alam mo yan. So remember, the vaccines we have now are EUA, Emergency Use Authorization, because the studies aren't finished yet.
Okay.
And when these studies are finished, then we will know really the length of immunity. So, nabanggit kanina ni Michael, di ba, yung kanila may booster sila sa September.
Yeah,
Ibig
a third.
sabihin, 1 year after, they will get a booster, and that was not in the original protocol. So these things are evolving as we go along. So either sagot yan sa variant or sagot yan sa interim results ng study. Pag sinabi ng interim results ng study na parang, kulang yung antibody formation, mag-boost ka. then
I-
that would be the answer.
So I think it's really important for the audience to know that all of these vaccines are constantly being studied. They're constantly being improved and
Yes,
getting
oo,
better. So
ongoing pa talaga yung mga trials. Pero we do have interim results that state na okay siya. May effect, may efficacy na siya.
so this is why
let's-
that we should take it talaga.
Yeah, that's right. Ano ba yung tanong ko? May tanong dito sa ating chat, okay? What are the parameters that PLHIV are eligible for to have the COVID vaccine? So, hindi kailangan na may CD4, hindi requirement. Hindi rin requirement na UD ka. Okay? So, walang eligibility. Pwede. Kunin mo na. In fact, naka-priority ang PLHIV. Okay?
Wonderful.
Nag-start na po yung A3 prioritization kahapon, today. So, ibig sabihin, kung nakalista kayo, pwede na kayong magpabakuna as soon as possible. Okay? Next.
For those who might not know, Doc, how do you get yourself registered in the A3 list?
Right. Okay. So, may mga palistahan po tayo online sa mga LGU. Paki-search na lang po, hindi ko po alam. Pero may mga kumakalat na mga links.
So it is with your LGU. It's
LGU.
not with your clinic. It's not with
Nope.
your treatment hub.
Nope.
Nasa LGU.
As
yun
of
yun.
now, correct.
Okay.
So as of now, ang mga LGU na may existing vaccine rollout,
Okay.
palista na kayo doon. Tapos alam ko ang requirement para sa PLHIV ay either MedCert or reseta or any proof na sila ay PLHIV para makapasok kayo sa A3. Ngayon, naglabas kahapon ng memorandum ang DOH na pwedeng mag-apply ang mga treatment hubs na pwede sila maging vaccine sites, but this has to, parang kailangan muna ng training, kailangan may capacity. So, kumbaga, mag-a-apply pa lang, i-inspectionin, a-approbahan para kung pwede sa treatment hub na lang. And this will serve the people who are hesitant to disclose to the LGU ng kanilang status. Kasi ang ending nun, kung hindi ka mag-disclose ng status mo, ang schedule mo ay hindi ka na A3. Ang
Yes.
schedule mo ay huli
Regular.
na.
Oo.
Regular ka na.
Regular.
So, kung mauna yung treatment hub mo na maaprubahan bilang vaccination site, pwede ka isingit doon. Mauna ka pa rin kasi nga, alam nila yung A3 priority mo. So, kung ano lang mauna. I think.
Okay. Thank you very much, Doc. Are there any more questions, Rad?
Yung isa, let me check ha. Probably mas maganda makasagot ata si Doc Kate. Ang sabi dito kasi ay our general practitioner mentioned that the HIV medicines can protect the LHIV from getting COVID-19. So do we even need the vaccine at all?
So, yes, you need the vaccine because wala pa pong evidence, medical evidence that any HIV medication actually helps either treat or prevent COVID. So, walang ebidensya para doon. Mahirap maniwala sa anecdotal data. So, magpabakuna na po kasi yun po, may data. Okay? Meron pa ba tayong question?
I guess it's just really important for us na especially for us PLHIV people na ang dami natin mga anxieties and fears na may maririnig tayong kahit anong mga bagay-bagay na sinasabi ng mga tao about what's possible for us, what's available for us. Kasi ako ay narinig ko din yun na yung anecdotal evidence na the ARVs daw can help prevent COVID. So what you have to do is you have to take care and take charge of your own information and your own protection. So yung ginawa ko, nag-Google ko. I did a Google search, ARVs prevents COVID. Tiningnan ko lahat ng mga articles at nakalagay talaga doon. These are anecdotal stories, anecdotal data. There's no analysis of this data. There's no study on this data. So hindi siya factual na information. And so because everybody's still looking, they're still studying, they're still trying to find out, it's also best to do your part na rin. Kung may naririnig ka na hindi naman galing sa medical community, kung hindi galing sa mga sa WHO, WHO, or all of these different established institutions that tell us what is factual and what is not, kayo na mismo maghanap din para tulungin na rin yung mga doktor nyo and mga healthcare officials, etc. na to find out what is true and what is false. I think that's also very important.
Very good. Dave, patapos na tayo. Meron ka bang
Yes.
parting message sa mga ating manonood?
Siguro kagaya po nung intention natin, no, na wag po tayong matakot, no, na tanggapin yung COVID vaccine. Kagaya nga po nung sinabi ko kay Sir Renz, no, yung araw-araw na pinagdadaanan natin ay hindi madali. Ako bilang isang frontliner at the same time as PLHIV, napakahirap makipagsapalaran sa laban ng buhay talaga, na lalo na kung wala tayong kalaban-laban. So it's a privilege and opportunity for us, no, to have vaccinated. So it's a big help for us, no, to prevent yung future infection, para maiwasan natin yung COVID vaccine. I'm not saying na pag tinake natin to hindi na tayo magkakaroon, but this is additional prevention kasi, no? Parang additional guard for ourselves na malilesen yung possibility na ma-acquire natin yung infection. So guys, huwag kayong matakot. And regarding naman po dun sa inyong mga status, kagaya po ng sinabi ni Doktora, no, i-follow na lang natin kung ano yung binibigay sa atin na guidelines and directions. Kasi sabi ko nga, we want to protect ourselves. Then in return, dapat meron din tayong handang ibigay to have that. No, we are asking for something, and in return, we must also be prepared to give something for it. Yun lang po siguro.
Sir Dave, thank you very much for being part of this talk with us. And on a personal note, also thank you for being a frontline worker, helping out everybody. Our frontliners talaga have been so, they're actual heroes. And so thank you for your service. Salamat Gid. And thank you for being with us and sharing your experience about getting their first shot of AstraZeneca.
Yes, well, you're always welcome. And if there is a possibility na magkaroon ulit ng ganito and I'll be asked to join it, and I'll be more glad and willing to help you guys to be on your advocacy, no? And to be part of whatever plan you have in the future. So maraming salamat din po for giving us the opportunity to share my voice, no? To encourage other people, also to encourage my co-PLHIVs.
Maraming salamat, Dave. Maraming salamat, Wango, for co-moderating today's webinar with today's conversation with me. And I am praying that you get your vaccine soon. Kung ano man yan, huwag ka mag-paracetamol bago magbakuna.
Thank you for having me here, Doc Kate. I'm very happy to be helping out and doing what I can to help spread the information. Kasi talaga maraming takot tungkol sa vaccine, and a lot of people are not taking the virus, this COVID situation very seriously. After this talk, I really want to get vaccinated now. Gusto ko magparehistro for that A3. Pero, you know what? I am in a position na pwede ako maghintay. I can work from home. Nasa bahay lang ako. I'm going to be safe in that situation. Pwede akong maghintay. I can afford it. Mauna na lang yung iba. But I want everyone to at least take it, because this is a very serious situation that we have. We have to take this seriously, and we have to do whatever means possible to protect ourselves and to protect each other. Thank you for having me here, Doc Kate. It's nice to be helping out with SHIP and all of your projects and programs.
Thank you. Thank you. Salamat, Kid, Wango. And now we turn you over to our coordinator for today, Sir Rad.
So again, thank you very much to our viewers, sa lahat ng mga nakatune in sa FB Live. Maraming salamat for joining us. To our guests, to Dave and Michael, and of course to our co-moderator, to Sir Wango, maraming salamat. So hopefully, we will have another round of webinar regarding COVID-19 and HIV. We will let you know. Just tune in. So again, thank you very much. So once we get the opportunity to get vaccinated, let us all get vaccinated. So have a good day, everyone.